Hello, my name is Daphne Ferrer. I'm a third-year medical student at the Krikorian School of Medicine at UNLV. Our presentation today is titled Thorough Evaluation of Altered Elderly Patient with Recurrent UTI History Uncovers Large Frontal Lobe Meningioma. Altered mental status, or AMS, is a non-specific sign that commonly leads doctors to suspect urinary tract infections, or UTIs, especially in elderly patients. Although this association has only been demonstrated in studies of limited methodological quality, it continues to contribute to unnecessary antibiotic use and subsequently higher healthcare costs. Overlooking other causes of AMS can also lead to more serious diagnoses being missed. We present a case of an elderly female with a 6-month history of recurrent UTIs who presented with AMS and was subsequently found to have a 6 by 6.7 by 6.1 centimeter frontal lobe meningioma, a tumor of the central nervous system that derives from the meninges, the covering of the brain. A 75-year-old female presented with a 1-day history of AMS. She denied any recent trauma or illness, but she did report a history of recurrent UTIs and urinary incontinence requiring her to use an adult diaper. She had a high heart rate and a low-grade fever, and on physical exam, she was oriented only to herself, meaning she knew her name and her date of birth, but she was not oriented to the time or place. Additionally, she had a large diaper rash. Lab findings were notable for a high white blood cell count and a urinalysis that showed signs of urinary tract infection, including nitrates, leukocyte esterase, and many bacteria. She was admitted to the hospital for acute encephalopathy, a disease or disorder that affects the function of the brain, and she was started on treatment with IV antibiotics. The following day, she complained of leg pain, stating that she might have actually had a fall, but she was unsure. We ordered a head CT, which showed a mass in the frontal lobe so large that it shifted the midline 2 centimeters and effaced the frontal ventricles, the cavities in your brain that are filled with cerebrospinal fluid. This can be seen in Figure 1. For reference, the different views from left to right are sagittal, meaning cut along this axis, down the middle of your face, axial, meaning cut along this axis, cutting right across your face, and coronal, meaning cut along this axis, like a crown would sit on top of your head. Compared to a normal head CT, you can see that the middle of the brain is just pushed over, and the ventricles are essentially compressed due to this mass. Another set of imaging, the MR brain, revealed that the mass was likely a meningioma. This can be seen in Figure 2, which also includes the measurements. Neurosurgery recommended a craniotomy with tumor resection after the completion of antibiotics. Repeat urinalysis was negative, and the patient underwent tumor resection on hospital day 10. Postoperative CT head without contrast showed complete tumor resection and decreased midline shift at 9 millimeters. This can be seen in Figure 3. The patient was discharged on post-op day 8 to a rehab facility with outpatient neurosurgery follow-up. This case presented a diagnostic challenge as the source of the patient's altered mental status was initially assumed to be due to her UTI alone. However, advanced age increases the risk of multiple other etiologies of AMS as well. In relation to this patient's meningioma, the incidence for all primary central nervous system tumors is 18.16 per 100,000 person-years in the general population, compared to 63.75 among those 75 to 84 years old. Yet AMS continues to be one of the most common reasons for suspecting UTI in elderly patients, often leading to antibiotic treatment. And unfortunately, studies have shown that 40 to 75% of the antibiotic usage is actually inappropriate, leading to unnecessary antibiotic use and increased healthcare costs. Fortunately, current literature advocates against reflexive treatment of UTIs in elderly patients with AMS, even with a notable urinalysis. However, the assumed association remains. Had this patient not endorsed a possible fall, the CT head may not have been ordered, and her large meningioma would have remained unfound. The assumed association between UTIs and AMS in the elderly is not only a risk to antibiotic stewardship, but also to the appropriate care of elderly patients, as other more serious sources of AMS can go overlooked. However, elucidating this relies on a thorough understanding of the patient history, which ultimately made all the difference for this patient. These are my references. Thank you so much for your time.